Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems Better Care podcast. I'm here today with Janelle Ball. She's a founder and CEO of BC Educators, who brings over 15 years of dermatology expertise and nearly a decade as a biologic coordinator training and consulting practices nationwide. Thank you for joining us today.
Thank you for having me. It's great to be
Yeah,
here.
yeah, absolutely. And just to give our listeners like the backstory, like how did you get here and like what are you building right now?
Yeah, so my backstory is, well, if you want to go way back, cosmetology. But I started in dermatology working in front office. My passion for dermatology just kind of stemmed from, just out of curiosity, excited about skincare. I previously actually owned a mobile salon business where I worked with brides doing events and weddings, hair and makeup for that. But, really got interested in dermatology space. So I started working in a med spa and then went to a full dermatology office. Started there, worked in the front office, kind of various roles, became, worked as medical assisting, nursing support. And then the prior authorizations in the biologics just kind of fell into my lap. It was one of those, that we had a clinical trial side at the office that I was in. And so the the girls, they started getting really busy with a lot of the clinical trials and they didn't have time to do a lot of the prior authorizations for all the specialty medications. So they came to me and asked, "Hey, would you be interested in doing this?" And I said, "Sure." I had no idea what I was signing up for. And they're like, "Oh, yeah, you just need to do prior authorization. That's all." And so it really just kind of opened my eyes and I started learning about the prior authorization process, how to get access for patients. And it really just kind of transpired into a passion for patient support, patient education, and then also workflow, streamlining workflows and understanding some of the issues that we were seeing in the office when it came to actually getting patients their medications. So I started consulting with some offices. And then eventually one day I was just like, you know what? I really would love to be able to support more than just one office at a time. At the time, was consulting with maybe two different offices. And then at that point, I was just, I wanted to expand it. And so I created BC Educators. And so the vision behind that was because I was seeing that there was a lot of workflow issues within the office. So my goal was to help streamline the workflow, the process, help make sure that staff knows, when medical assistants come in, they need to know what questions to ask the patients, how to get specific documentation so that we can get the best outcomes when it comes to insurance, because that's always been a burden and it's continuously growing. And that burden of insurance trying to dictate what the patient should be on or what they shouldn't be on, and step therapy requirements and all of those things, it's a frustrating thing when a patient, you think of your going into a doctor's appointment and they're prescribing you a medication that they're telling you, okay, this is a great option for you. This is going to work, especially with someone with a chronic condition like psoriasis or eczema. And all they want is to get better. So, the doctor prescribes this medication and then they get a denial letter from the insurance and they're like, well, wait a minute. My doctor said this was a great medication and now my insurance won't cover it. So what do I do next? And, at that point, either the patient comes in and is frustrated at the doctor or they just disengage altogether and go somewhere else. And so my thought process was I really want to be able to support the office and the patient. But then also this role as a biologic coordinator is growing. And we're kind of the liaison in between the office, the patient, and the insurance company. We're kind of bringing all of those together because we work with the insurance company doing those prior authorizations and understand what exactly is needed. And we're also educating the patient to say, hey, you know what, there's manufacturer support programs available. There's, if you get an approval with your insurance, that doesn't always mean that you're going to be able to get it at a low cost. So we're looking for those low costs to share with the patient to say, hey, just make sure you set up this copay card and you can have a $5 copay or a $0 copay. And then also communicating with the office, with the doctors to say, hey, whatever you decide is best for your patient, that's what you should write. You shouldn't write a prescription based on, oh, insurance never approves that, so I'm not going to write this drug anymore, even though it might be a really great option. all it
Yeah.
really comes down to is understanding what that criteria might look like and how can we document properly. Or are there other reasons why they can't be on these other medications? What are some of the contraindications? What are some of the patient history and those comorbidities that the patient may have that we can document so that we can get this approval and make sure that it is allowed by the provider to or the prescriber to really dictate and determine what the patient should be on versus allowing the insurance just to say, nope, try this one instead. And that may not be a great option for the patient. So really, there's so many different factors that came into BC educators, but now our goal is really to support as many offices as we can, and we're growing, and there's a passion there, and every single person that I bring onto our team is passionate about this as well. They love being able to help patients. They are passionate about understanding the insurance terms. I mean, there's days that it can be very frustrating and you're yelling on the other end, but there's just a lot of passion that goes into it and really helping patients. And I think that's why most people get into healthcare in the first place. It's because they have a passion to serve and to support patients. And that's really kind of what BC Educators is about, is supporting the office and supporting the patients to get access to these medications that can really change their lives.
Yeah, and when you look at the industry as well, because now we're thinking of kind of like small practice. We're looking industry wide, looking at all these practices that you want to break into and help, specifically like the patients, helping them navigate, almost in a sense like their advocate, and the clinic as an advocate as well throughout that process. What's like
Oh,
one
yeah.
shift that you're seeing right now with these practices that you're working with, specifically, dermatology practices?
The biggest shift that I'm seeing is a lot of AI. AI is coming into the play, and it can be a great thing. I think AI has a place. It's not completely there yet. You still need to have that human touch, and I think a lot of offices are relying solely on AI and thinking that this is just going to really make everything better,
Yeah, solve
and
all their
that's not.
problems.
Yeah, it's not going to solve all the problems. It's a lot of times we always think of, oh, it's just a prior authorization. And it's so much more than just a prior authorization. There's so much that goes into it. There's a lot of patient education. If you're not engaged with your patients, and, most of the time when you go to a doctor's appointment, you leave the office and you forget at least 50% of what was told to you, especially when it comes to starting a chronic specialty medication for a chronic condition. And so there has to be a lot more patient education and engagement throughout that process so that you can make sure your patient fully understands what they're doing. Most of these biologics, they're not a cure. They're taking them for the rest of their life. So if you're not educating your patients and just relying on AI just to do a prior authorization and expect them to reach out to the patient so the patient gets their medication, that's not how it works. You've got to have that communication, that open line of communication, so your patients feel valued, they feel understood, they feel like their concerns are being taken care of, and that the more confident and knowledgeable that they feel about a medication that they're taking, the higher chance of them staying on the medication long term, coming back in and asking those questions that might be important, versus stopping a medication when they get sick or when they have to go get a injection or something. Instead of just stopping the medication altogether, they're going to understand that, hey, I need to communicate with my doctor and figure out what the next step is versus just kind of making my own decisions. And I think that's one of the biggest things that's lacking in a lot of offices is the lack of communication, between patients and just expecting them to take things on their own. But yeah, AI is definitely, and we use it sometimes to an extent as well. It can be very beneficial if it's used properly. I think that's the biggest thing is making sure it's used properly and being able to utilize it as well. But that's definitely one thing. But also, insurance is becoming more and more difficult. Step therapy, the documentation. There's so much shift because in healthcare we're seeing so much turnover. And you get new people in all the time. And, as an MA, that's not something that you're specifically trained on when you come in to learn how to do prior authorizations and deal with the biologics and the specialty medications that are available. At least in the derm space, that's what I see a lot of is, there's a challenge there. So making sure that everybody is on the same page and understands what support programs are available. There's new drugs that come out every single month and there's a new program for each drug. So being able to stay up to date on all of those things, it can be very difficult sometimes. Kind of keeping up, staying up on the trends and understanding how to really incorporate AI the best way so that it benefits your patients versus just alienates them and expects them to answer a call and get your medication.
Yeah, there's definitely more to it. Like you said, the most successful practices are the one are not completely autonomous, but there's a human in the loop aspect where they're
Mhm.
doing a checks and balances of what information is being communicated or not being communicated in some cases as well.
Yeah.
And what's going on as far as like within your own operations as well? Have you adopted to AI in any way, or what does that look like as you're working with these practices?
Yeah, we're working on some things as well, but we right now there's AI is in so much. Even with the prior authorizations, when you're submitting the prior authorizations, whether it's like through platforms, the prior authorization platforms, there's AI in there. There's AI that's reviewing the prior authorizations. There's a lot of AI in these as well. Sometimes we do a lot of AI with helping to generate appeal letters. So like if we're writing an appeal, then we can use AI to help pull the information that we need that can, have backup clinical trials and studies and things like that that we need to pull off the internet that can show. And there's so many different tools that we can use. I mean, Chat GPT is one. We're in dermatology, so there's Derm GPT and there's some other platforms as well. But, which is really good. And it kind of helps to provide some of that information and we can kind of know exactly what resources we need to pull and utilize. But yeah, there's definitely more things that are coming. And, as we're automating processes and just some of those small tedious tasks. But yeah, it's coming for sure.
Yeah, definitely is. It's coming whether you like it or not, right?
Right,
Unfortunately.
exactly.
Yeah, and you mentioned Derm GPT. I haven't heard of that personally. I'm sure the audience has it. Do you mind kind of expanding more upon that?
Yeah, yeah. So there is a dermatologist out in California. Her name is Dr. Farah Kamangar. She is the creator of Derm GPT, and it's a really great tool because it pulls all of the trials and just all kinds of dermatology information in one place. And so, yeah, it's a newer tool. I think they just did some new updates to it, but it's a really great tool to search for anything dermatology related.
That's excellent. I'll definitely have to
Hmm.
check that out later. So thank you for sharing. And then looking, at your current results, any bottlenecks that you're running into, what's going really well with these clinics that you would never want to lose?
What's going well? I think it's the workflow, understanding a good workflow and making sure that everybody plays such an important role, knowing that, it's not just oh, your biologic coordinator or your access coordinator is doing the prior authorization. It's knowing that your front office is getting insurance cards. They're the face of the company. They're the ones that are communicating with your patients and as soon as they walk in the door. So if your patient is coming in with a chronic condition, 9 times out of 10, they're probably not going to be feeling the greatest. They're not coming in because yes, they are coming in when they're doing better, but most of the time when they're initially coming into an appointment, they're miserable, they're frustrated. And so those attitudes can tend to be a little bit different. So understanding, front office needs to understand that you might deal with some patients that may be in a bad mood and it might be difficult to manage. So it's understanding that you're the face of the company. And so you set the tone. You set the tone for that patient that's coming in and how you react to whatever is going on the other side of the glass or the wall. But that sets the standard. It sets the tone for that patient coming in for that appointment. So, that right there is really important. Insurance cards is really important, pulling all the information and the details. But it's really a flow. You come into the office and then your medical assistant takes you back into the room. That process is important as well because now you've got somebody that's asking questions that are getting all of the details and things that we need before they see the doctor. So setting those expectations as to, what their history is and what they've tried and failed in the past and getting all of those details can make such a huge impact on getting access to the medications. And that way the doctor can see that or the PA or NP can see all of that info and now they can make a good decision and then it goes to your coordinator, whoever's doing the prior authorization or phone nurse or anybody else after the fact, but the patient touches everybody in the office. So it's just understanding that everybody should be working together, and setting up a good process and a good workflow is one of the biggest things, along with the documentation. But those are the two big things that we're seeing, when we have our coordinators that are working remotely with any office. We want to make sure that that workflow is set up properly, and that we're able to communicate with, whoever it is that we need to connect with, whether it's, the MAs that are working with the patients. But gathering all those details makes it so much more impactful. And now that we're able to communicate with the patient and doing that patient outreach, now we can relay that information. And then we're kind of the person that is keeping all of that together. So we're keeping the doctor up to date on, hey, this is the status of the prior authorization. And now they've been approved. They have to go to a specialty pharmacy. They've got a copay card. We've got all of that set up for the patient. Or if there's a denial, now we can talk about what those next steps are. Is there a bridge program for them to get medication while we're waiting on the appeals process? Or, how we're going to incorporate that into the workflow. There's the workflow, I think, is a big piece of it. And making sure that everybody is kind of on the same page when it comes to getting patients access. And when everybody's kind of doing their own thing in an office, it makes it chaotic and it doesn't make things run smooth. It just causes a lot of disruption and a lot of questions left unanswered, especially for the patients.
And, looking at your vision as well for BC educators, where do you want to be in 6 to 12 months?
Continuously growing. We do a lot. We do a lot of education. We do monthly webinars. We also have a monthly newsletter that we send out. And we actually just launched it's called the Access Line. And so our Access Line is really more patient facing. And so, I've talked at a lot of different conferences. And, one of the things that I know still unfortunately is happening is that so many patients are not getting the support that they need and that they deserve. So, our goal with our Access Line is really to provide resources, provide support, and provide education. And if there is patients that are not getting, maybe they don't know what the next step is if they've got a denial and their office is not quite sure either. We can kind of jump in and help the patients and really kind of give them information about, okay, you can appeal. Patients can do a lot. They've got a lot of authority when it comes to getting a denial from the insurance company. They can appeal things on their own. They can share more information with their doctor, especially depending on what that denial letter states, why it was denied. So there's a lot of information and support that's out there. And, whether it's patient assistance programs that are available, just being able to be that additional support outside of the office and more directly towards the patient, I think is something that is, I'm really excited about. I didn't realize how much of that was still actually happening and how much support is still needed. But I think the other part is, patients have to understand that there's resources. There's so many things that are available. There's so many different foundations that are there to really help the patients get access to the medications and, understanding how to take the medication, why they should continuously take it and not, miss a week or miss a month or, miss a dose here and there. And then they're wondering, why am I not getting better? So just those little tips and things like that we can help provide. There's definitely a lot of growth and, our goal is always to expand and to help as many offices as we can. Our goal is to, continue in dermatology for sure. And then also expanding into other specialties as well so that we can really help, more patients, more offices. It's a struggle, unfortunately. Insurance is not changing anytime soon. It just seems to be getting more and more difficult as insurance tries to find different ways to to make it difficult.
Yeah.
But yeah, as we navigate that, our goal is to navigate it as well. And, we want to kind of be that standard and set the standard and knowing that there is access there. We want to support our doctors and the nurses and the PAs when they're prescribing and treating their patients. And, that's one of the ways that we can do that better is by knowing how to deal with insurance, how to understand what the insurance requirements are, and implementing that within the office so that it makes it a little bit easier.
Yeah. And where can people find you as well to connect and learn more? Or
Yeah,
where's the
so
best place to do
can
that?
yeah, we can check out bceducators.com. You can go to our website. You can email me at Janelle at bceducators.com. And yeah, absolutely. And I also have a dermatology podcast as well. And so it's called That's Derm Good. So I talk a lot about dermatology related stuff there, but it's all dermatology. In BC Educators, we're focused more on specialty medications and the prior authorization process, but That's Derm Good is more all dermatology related. And so I talk to lots of cool people. There's some amazing things happening out, that just when it comes to support and access and affordability and advocacy. So I'm all about that and always trying to share any knowledge that I can and connecting.
Well, genuinely appreciate your time today. It's been a lovely discussion and really appreciate it.
Yes, thank you. Appreciate you having me on.
Yeah, absolutely.
All right, take care.